Ibuprofen suspension, the final dose form, is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. This form of ibuprofen is specifically intended for use in children. Do not give this medication to a child younger than 2 years unless directed by the doctor. It is important to check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Additionally, products with similar names may contain different ingredients meant for different purposes, so taking the wrong product could harm you. When taking ibuprofen suspension, make sure to carefully follow the instructions on the product package if it's over the counter, or the medication guide provided by your pharmacist if it's been prescribed by your doctor. Take the medication by mouth every 6 to 8 hours as needed, and shake the bottle well before each dose. Use a special measuring device to ensure you get the correct dose. If you experience stomach upset, take it with food, milk, or an antacid. The dosage will depend on your medical condition and how you respond to the treatment. It's important to take the lowest effective dose for the shortest possible time to reduce the risk of stomach bleeding and other side effects. Do not increase your dose or take it more often than directed by your doctor or the package label. For children, the dosage is based on their weight, so be sure to read the package directions to find the proper dose. If you have any questions or need help choosing a non-prescription product, consult your pharmacist or doctor. If you're using ibuprofen as needed, it's best to take it at the first signs of pain for it to work effectively. If your condition worsens or you think you may have a serious medical problem, seek medical help right away. And if you're using the non-prescription product to treat fever or pain, consult a doctor if the fever lasts more than 3 days or the pain lasts more than 10 days. Some common side effects of ibuprofen suspension may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Ibuprofen suspension may raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects such as easy bruising/bleeding, changes in hearing, mental/mood changes, unexplained stiff neck, signs of kidney problems, changes in vision, or symptoms of heart failure. Rarely, this medication may cause serious liver disease. Seek immediate medical help if you experience symptoms of liver damage such as unrelenting nausea/vomiting, loss of appetite, dark urine, stomach/abdominal pain, or yellowing of the eyes/skin. Although very rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist immediately. Ibuprofen suspension, final dose form, is a nonsteroidal anti-inflammatory drug that may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while taking this drug but is more likely if you take it for a long time. The risk may be greater in older adults or if you have heart disease or increased risk for heart disease. Do not take this drug right before or after heart bypass surgery. This drug may rarely cause serious bleeding from the stomach or intestines. This effect can occur without warning at any time while taking this drug. Older adults may be at higher risk for this effect. If you notice any of these rare but serious side effects, such as stomach/abdominal pain that doesn't go away, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, stop taking ibuprofen and get medical help right away. Remember to talk to your doctor or pharmacist about the benefits and risks of taking this drug. Before taking ibuprofen suspension, it's important to let your doctor or pharmacist know if you have any allergies, especially to aspirin or other NSAIDs. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Make sure to discuss this with your pharmacist to get more details. Tell your healthcare provider about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems. It's also important to mention if you are pregnant, planning to become pregnant, or breastfeeding. This medication can make you dizzy or drowsy, and alcohol or marijuana can enhance these effects. Avoid driving or operating machinery until you know how this medication affects you. It's also important to limit alcohol consumption and talk to your doctor if you are using marijuana. Ibuprofen suspension may cause stomach bleeding, especially when combined with daily use of alcohol and tobacco. It can also make you more sensitive to the sun, so be sure to limit your time outdoors and use sunscreen and protective clothing. If you have diabetes or phenylketonuria, talk to your doctor before using this product, as it may contain sugar and/or aspartame. If you are an older adult, you may be at greater risk for certain side effects of this medication, such as stomach/intestinal bleeding, kidney problems, heart attack, and stroke. Women of childbearing age should discuss the benefits and risks of using this medication with their doctor, especially if they are pregnant or breastfeeding. Before having surgery, be sure to inform your doctor or dentist about all the medications and products you are using. And if you are breastfeeding, consult your doctor before using ibuprofen suspension. It's important to know that ibuprofen suspension, in its final dose form, may interact with other medications, which could change how they work or increase the risk of serious side effects. This includes medications like ACE inhibitors, corticosteroids, and blood thinners. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, be careful with other medications that contain pain relievers or fever reducers, as taking them together with ibuprofen may increase the risk of side effects. If you are taking low-dose aspirin for heart attack or stroke prevention, talk to your doctor about the best way to manage your medications. It's important to follow your doctor's instructions and not change the dosage or timing of any medicines without their approval. If someone has taken too much ibuprofen suspension and has severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include severe stomach pain, difficulty breathing, and extreme drowsiness. If your doctor has prescribed this medication, it's important not to share it with others. Your doctor may also conduct lab and/or medical tests, such as checking your blood pressure and kidney function, while you are taking this medication. It's important to keep all your medical and lab appointments and consult your doctor for more details. If you take ibuprofen suspension on a regular basis and happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to skip the missed dose and take the next one at your regular scheduled time. Avoid taking a double dose to make up for the missed one. Always stick to the recommended dosage and timing to ensure the best results. It's important to store ibuprofen suspension at room temperature, away from light and moisture. Avoid keeping it in the bathroom, and always store it out of reach of children and pets. When it comes to disposing of the medication, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.